Microneedling radiofrequency, it's a combination of microneedling and radiofrequency. That's microneedling radiofrequency, which is MNRF. In MNRF, there is application of controlled radiofrequency energy directly into a certain depth of dermis with minimally invasive microneedles or electrodes. It reduces treatment time and recovery time as well. Even darker skin can be treated with it because it is colorblind. So there are two types of needles which are very commonly used in MNRF devices. One is non-insulated needle. In non-insulated needle, the radiofrequency gets emitted from the whole length of the needle. So in this case, epidermis also gets damaged a little bit. So whenever using non-insulated needle, you can be prepared for the downtime and chances of PAH if you go more aggressive with non-insulated needles MNRF. In insulated needle, the needle is insulated the whole length. Only 0.3 millimeter of the needle is emitting radiofrequency. So in insulated needle, the radiofrequency gets emitted only from the tip of the needle. So in this case, you see the epidermis is spared. So you can decrease the depth of the insulated needle and treat the scar at various depths without damaging the epidermis. There are two types of radiofrequency which are available with the MNRF devices. One is bipolar radiofrequency. In bipolar radiofrequency, the radiofrequency gets emitted from one electrode and it goes inside it gets absorbed in another electrode. So one is positive, another is negative. If you see bipolar radiofrequency, the radiofrequency is confined to the tip of the microneedles here. So it is very, very good for treating scars, open pores, and wrinkles. And in monopolar radiofrequency, the radiofrequency gets emitted from the needles. It goes deep and diffuse and gets absorbed and goes out of the body through the grounding plate. So as it goes very diffuse and deep inside the skin, it is very good for skin tightening and lifting, which scores over the bipolar radiofrequency. I have been working on this technique past so many years called Wosyet Vital Technique. In this technique, we have combined multiple depth rotational stamping, bipolar radiofrequency, followed by monopolar criss-cross technique. I just tell you how you do it. In rotational stamping, you have to fix the probe on the scar and fire the radiofrequency, and then rotate it to 30 degrees and fire it again, and rotate it to 30 degrees and fire it again. So you have given 3 shots at the same area without moving the probe. So in multiple depth rotational stamping, you choose a depth of 1.5 millimeter and give 3 shots with rotational stamping. Reduce the depth to 0.8 millimeter and give it again. And reduce the depth to 0.5 millimeter and give it again. So you have treated a scar at various depths by reducing the depth of the insulated needle, and the epidermis remains spared in this kind of treatment. After doing the scar treatment with multiple depth rotational stamping, you treat the whole area with criss-cross monopolar radiofrequency technique. In this case, you give 2 passes of monopolar RF on the whole cheek. So by combining monopolar and bipolar, we have treated the scar and also improved the collagen remodeling in the whole area, so which lead to skin tightening and lifting in that area. So by combining these 2 techniques, you can see in this patient, after the treatment, there is remarkable improvement in the scars, and the skin tightening and lifting is also there. With this, I thank you all for patient listening and hope you understood the basic mechanism behind the technology and microneedling radiofrequency. Thank you. Have a nice day.